Good morning. Today we are with Carol Bender with Joy Wellness Partners, and she is a nurse practitioner for over 10 years, specializing in regenerative medicine and integrative medicine. She earned her dual bachelor's degrees of science in economics and nursing, also specializing in adult gerontology acute care. And I'd love to learn a little bit more about that. Sounds amazing. She co-founded LifeNet International. She has a nonprofit conversion franchise of healthcare clinics in Burundi, Africa. She founded Joy Wellness Partners in 2016 in San Diego, California. And she started Enliven Aesthetics in order to better the life of her clients and their aesthetic needs. Welcome to the show, Carol.
Thank you very much, Tori.
That was a mouthful.
I'm sorry.
Amazing. I'm like, wow, you've gotten your double and you've gone through all of the schooling and you're working in multiple nations. That's incredible. Absolutely incredible. So you're in California. You are based out of California. You can find her at joywellnesspartners.com. It looks like you are integrating pain and injury. You do IVs. There's so much. You've had a few podcasts here. You've been on different shows. And she's an amazing woman. I just want to talk a little bit about bioidentical hormone replacement therapy that they call BHRT. And how is it different from traditional hormone replacement therapy?
Well, traditional hormone replacement therapy, of what most people think, is often synthetic. And that means that a lab creates the molecules to look very similar to the body's molecules that we have. Whereas bioidentical takes the plant version of those hormones and just puts it into a form that we can absorb. So if you would look at it on a microscope, the molecular structure from the plant would be matching identically to the molecular structure in our bodies, which makes it bioidentical. And it basically, what that means simplistically is that the key is an exact replica and opens the lock exactly the same way as the key that you were first given to your house. So the cells can work optimally as a result, and all of the different functions are activated when those bioidentical hormones go into the body.
Wonderful. And what symptoms can BHRT help alleviate?
Those symptoms that are commonly complained about, especially the aging symptoms of fatigue, sleep problems, not waking up refreshed, feeling that you have a slump during the middle of the day, weight gain, hot flashes, muscle mass decline, aches and pains in the joints, mood swings, anxiety, depression, and just the feeling like your best years of your life are over. All those symptoms are usually connected in some way or another to hormones declining in the body. So bioidentical hormone replacement therapy can be that replacement to get you back and fill your cup up.
And what I love is that not only can we help ourselves, but we can help our friends and families too. And I just want to encourage everybody to please share for your loved ones. We've, talked about many types of relationships that are affected by this, not just how we feel about ourselves on the day-to-day with the weight gain. I mean, we've all gone through the stresses of COVID and the changes that has had on our bodies, let alone the aging process and all of the stresses of life, and on the marriages too, and on the relationships. So I just want to encourage you to please tune in, listen up, and please share. Excuse me. Please share as we're talking into the groups that you think that others would like to learn a little bit more about this. So are bioidentical hormones safe?
Yes, they are safe. They have the exact replica of what your body was doing previously. So some of the concerns with older, more traditional models of hormone replacement, the synthetic versions, those actually signal to the body in a slightly different way than the way the body was naturally working previously. So some of those signals confuse the body and can make patients have a little bit of increased risk of side effects or concerns. But that's because the key isn't an exact fit, whereas bioidentical eradicates that risk and actually provides benefit, cardioprotective benefit, and benefit for the bones, the breast, the brain, and many other aspects of wellness as we age. They're safe. Yes, they have been tested and they have been found to be pure. And even the FDA regulates the labs that are producing these molecules from plants. And it's really cool to see that they can actually help you prevent diseases.
So what are the risks and side effects associated with BHRT?
Sure. So the risks are that you might get a little bit of a too high of a dosage. That's really too much of a good thing isn't really the best thing. So we want to have you in the sweet spot where you're not depleted anymore, but you're not overtreated. And additionally, the side effects that can come from having too high of a dosage would be things like whiskers on your face or hair thinning, a little bit of breast tenderness, or maybe even spotting. Those are the things that women would have if they got too much of testosterone or estrogen, sometimes even too much vaginal discharge. So these are things that we would really work with each patient to customize their dosage specifically for them. We talk to them and say, ask them their activity level and their weight, and as well we talk to them about their ability to kind of use different substances, like are they really sensitive, or do they need 12 different injections of anesthetic to actually make it work? Those kind of things affect how the body will process the hormones. So we titrate and we adjust and we customize it to each person so that they can work up to their optimal dose. We try to start slow, start low, and then work up.
Okay, and I'm guessing there's a lot of blood work and little markers in order to determine.
Correct. We start with a
Okay.
panel that's very comprehensive. It includes testosterone, estrogen, progesterone, all the thyroid numbers, about 4 or 5 different thyroid markers. We check the liver, the kidneys, the blood levels, the baseline blood levels. We check for iron, we check for vitamin D, B12. Some different vitamins can give us key indicators and clues as to how the body has been functioning and processing hormones, and gives us a clue as to how they'll receive the hormones if the patient does want to replace the depleted hormones that they have in their body. So once we find a level that's suboptimal, then we can tell the patient that, this low level of testosterone probably correlates to why you're feeling sluggish in the morning and not feeling the effects of the gym workouts as much as you used to, not having that, desire to be intimate as much as you used to, and also finding that your mood might be just low and not as motivated. So those things we'll say are connected to your low testosterone. So would you like to work on replacing some of that testosterone? And, we tell them the different ways to do so.
And with all of the environments, honestly, after I got COVID, half my hair fell out. There was indefinite changes to even my skin, achy bones, my joints were hurting. So for people that went through long COVID, this is a wonderful way to get your thyroid or your hormones checked out to see if she can do a balance check for you. And your tests are different than the standardized tests that they do at the other say their regular doctors, their healthcare professional. Is it a little bit more in depth?
True, it's more in depth. There's about 15 markers that we test for, whereas the traditional, 15 tests, which include probably about 30 markers, and the traditional primary doctor might test 3 tests that would show about 10 markers. So we're more comprehensive because we want to customize it to the patient. We have more time in our appointment consult to really dive in deep and find out some of the common causes of symptoms that are not optimal for the patient. Yes.
Wonderful. And how long does it take to get an appointment with you? Is it
less than a week? We're really trying to be available to our patients.
Yes, that's wonderful. And I know that if we make an appointment, doctor appointment, especially these days after 2020, it seems like it's months down the road unless we have to go to urgent care or the ER just to get seen and to get these things handled. It's really been difficult for many.
Mm-hmm.
Many friends that have had these issues as well.
Mm-hmm.
That sounds wonderful. I heard it will cause cancer. I'm wondering if this will cause cancer later down the road or.
Yeah, great question. In fact, it will not cause cancer. Cancer is often correlated with those estrogen receptors with breast cancer. So patients that have been on synthetic hormones may have found that there was a link to the estrogen fueling the breast cancer, but the synthetic hormones are the key. And we are very not synthetic, we're very bioidentical. So that risk is completely mitigated and completely zero. In fact, the breast cancer, if you think about it, it really doesn't often come, breast cancer doesn't really come to people in their teen years and their 20s very often. Most of the time, it's women that already have been depleted in hormones. So we find that by optimizing all the hormones, we're talking especially progesterone and testosterone, because those breast cancers can be caused more from an estrogen dominance place where people, as they age, may not have the testosterone and the progesterone to balance the estrogen anymore. And so we really look at the patient and help them to have the right amount of testosterone and progesterone to provide the protective benefits to prevent breast cancer as much as we possibly can. So it's the bioidentical and it's the right balance that makes the difference in our hormone replacement.
So with all of the sprays and the foods and things that we have in our environment today, even men are low testosterone, which is causing a depletion of their muscles, muscle tone, their overall health, their look, depression, and so on. So you treat men as well. And I just want to allow our audience to know that you do also treat men and women. And so that men can feel vitality and strength and, endurance and everything. So if men are having a hard time, what is it, like 60% lower than it was 25 years ago, in, having testosterone or progesterone and all of this in our bodies. And so you can imagine how women are also suffering for the same causes, and it could be the food that we're eating and our environment as well. And all of the plastics also are a false estrogen. So we're eating out of not glass anymore. We're not getting bottles of milk sent to our front doors anymore. Everything's changing all of. So it's
right.
I'm so grateful for your, what you're doing for all your clients. So I'm also curious, does it also help or have an impact for risk of conditions like osteoporosis, heart disease, Alzheimer's?
Yes. The link between low hormones and chronic diseases like Alzheimer's are found in several research articles that we really find that optimizing testosterone can help people to preserve their memory and preserve their brain function. I have patients that tell me they used to be really struggling with remembering where their keys were placed or trying to think about what the code was for their front door, and they were just wondering what was going on. And once they got their testosterone repleted, then they felt like their brain was sharp and acting like they were when they were young again, and their memory was coming back. So that's the short-term symptom relief, but with the long-term preventive benefit of preventing that disease. So that's the osteoporosis, or that's Alzheimer's. Osteoporosis, they've found that testosterone rebuilds bone density 8% per year, which is incredible compared to other bone building prescriptions. There's such a cool benefit with using something that's natural and also helps you feel great and also promotes your bone density. The other aspect of the cardiovascular benefit is that testosterone and all the hormones in conjunction are cardioprotective because they help reduce inflammation and reduce the stickiness of the blood flowing through the arteries to prevent the cardiovascular disease. And we talked about the breast cancer prevention when the hormones are in the right balance as well.
That's wonderful. I mean, who wouldn't want that? And it's beneficial for everybody. What's the age groups related to the patients that you treat?
Yeah, traditionally we treat patients that are in their 30s to their 80s. So there's a wide range. Basically, in your 20s is when some people start to deplete their hormone production. And depending, like you mentioned, the plastics and the different environmental factors, that's probably why we're depleting or we're not producing as many hormones till we age. That's one of the factors. Another factor, I think, is that our endocrine system hasn't necessarily changed or evolved to keep producing all the way till our long lifespans of 80 years old. We're pretty much able to keep our hormone production up until we've completed our family creation. And then at that point, the hormones start to decline. So in the 30s, in the 40s is when most patients will start to feel some sort of change in their bodies and some change in their results. They're not getting as much results from their workouts. They're not having as much desire for intimacy. They're not enjoying their best life. They might feel less motivation and more anxiety. And also the weight gain we mentioned in the belly fat, that kind of around the waist circumference can be a real sign of a hormone imbalance. And all those things get to be clues to make a patient say, maybe I should get my hormones checked. I think it'd be nice to have some answer rather than just to think I'm going crazy and having, the rest of my life 40 years ahead of me without having that enjoyment anymore. So then they get their hormones checked. Maybe it's their friend that tells them to come in. And so if they haven't heard about us before and then their friend tells them, they may take a year to decide, but it really works for anybody in their adult years. Truly, there's no age that's too old to get your hormones checked and balanced.
Wonderful. And I can't help but think about the single moms out there who are having to, work 2 jobs, working through COVID, gaining weight, already stressed out, they're high cortisol and their brain function, just trying to get their kids into school and sports and, just trying to live the day to day. And how wonderful that you have also, you have the IV lounge, which enables them to give them a boost of all their nutrients, which lasts a few months at a time. And so you begin to feel optimal again.
That's right.
Like I said, when I had COVID, I lost half my hair within 3 months, and not just me, but a few of my friends. And I still have some in their 60s and 70s who have had it, and they're on oxygen now. They have recovered. And so you have a myriad of things that will help replenish and get them back into optimal health. And it is quite affordable if you wait, it's every 4 months, correct? If you do the pellets, and we'll talk about that in a minute. Wow, I'm just I'm telling you, this is really going to help so many people, and I'm so thankful for what you do.
Oh, Tori, thank you.
Yes, I think it's just wonderful. So is BHRT customized for every patient individually?
Yes, it is. With the blood work that we find that you have in your blood work, as well as there's other options for testing too. We can go into that if patients really want to get saliva hormone testing or urinary hormone testing. There's many ways. So it's even that lab testing is customized per patient's request and preference. And then the results, we talk with the patient, we talk about their symptoms, their medical history, their family history, any type of, risk factors that they may have. And then we go forward and we use a standardized calculator that puts all of those pieces in. So we're also using, standardization for accuracy, and it customizes the patient's their hormone treatment plan, and we can adjust it, we can tweak it based on those conversations. So each patient gets something very unique for them. And like you mentioned, cortisol, that's a lot of times something that we work on as well, even though that's very very unlikely to be tested in a traditional medical office, but it can actually suppress all the production of hormones. So we really, really work with patients individually to find out where the source of their concerns are highest are coming from. What's the cause?
I love it. And so what types of hormones are used in BHRT, and how are they administered?
Yeah, so the names of the hormones are often thyroid replacement, testosterone, progesterone, cortisol balance, and estrogen. Those are very common hormones that we work with. The DHEA and pregnenolone and DHT, those are other hormones that we might have to address on a case-by-case basis. But the common, 4 or 5 hormones we work with can be administered in either a cream or a pellet, or some are administered via a pill that's dissolved under the tongue, and some are taken orally. When patients talk about the most common hormones, testosterone, estrogen, for women, we're talking about testosterone and estrogen. Those are most commonly administered via pellet or cream. And then shots are an option as well for testosterone. And we like to give patients the freedom to choose which one is the most comfortable for them. And personally, I prefer the pellets because we talked about they're every 3 to 4 months. And so you can come in 3 to 4 times a year, and then that just replaces your hormones in a little tiny pellet that goes under your skin through a tiny procedure that we do in about 5 minutes. And then you can have that replaced, that steady level of hormone for the next 3 to 4 months without having to think about it, without having to open up your pill container for that specific hormone. And then we give you the vitamins to supplement. So vitamins can help to make the hormones flourish in your body, again, the way that your body used to synergize it all naturally. We provide the vitamin supplementation to help optimize the hormone utilization in the body to make it work the best possible way for you.
Okay, wonderful. And I know that for some people, say if you've had cancer, then you'll receive it via cream, correct? So is there any people that you cannot treat, or that that would not be a fit for this kind of therapy?
That's a great question. Yeah, there's actually no one that's not a candidate for the hormone testing and the hormone replacement, but there are some cases where we individualize the plan. So with a patient that has had history of cancer, we don't give them estrogen, just to be on the safe side and to make sure that they are feeling comfortable with the regimen that we're working with.
Wonderful. Okay, I love that. So it's very strategic for each person, and you spend lots of quality time getting to know their history and what's going on with them, and
Correct.
doing all kinds of tests. I love that.
Yeah.
So how does BHRT affect fertility and menstruation?
Yeah, great question. So for men, the testosterone acts like a blocker of the testicle production of testosterone and sperm. But for women, it actually helps to support the ovulation and the ovaries' health. So healthy ovaries provide healthy egg production, and then that provides a healthy egg, and fertility can be more optimized as a result. So that's testosterone. Progesterone is also incredibly important in fertility by helping to provide the uterine lining that is a great environment for that egg to adhere and to be nourished throughout the pregnancy. So progesterone, testosterone, those are very commonly given to younger women who are trying to work on their fertility. And what we find is that sometimes women have concerns with having regular cycles. And so the hormone balancing, again, estrogen dominance can be a very common cause of these concerns with fertility and with cycle problems. And so putting in some testosterone or progesterone, or even digging deeper into the root causes of their environmental imbalances, we can really help people to get more onto a regular schedule and naturally conceive again.
Wonderful. So if anybody's having an issue, or if you guys know of anyone who's having an issue getting pregnant, this can help, create an environment where they can get pregnant a lot easier, a lot faster. So this is all natural. So it's not going to, I've heard, and correct me if I'm wrong, that people who take, who have been on protection from having babies. So whatever types that they would, that can affect also the hormones and being able to have children later on, and even health risks and things like that. Have you?
Yes.
Yeah.
Yeah, that's a great point. The most contraception that women will use, most of it has some hormonal component, and those hormones are synthetic. So whether it's IUD or an implant or birth control pills that are oral, they have synthetic hormones in them, and those will cause the body to, those are the types where it will suppress the body's production of natural hormones and cause an imbalance that could provide risks like blood clots, and also make it more challenging to conceive for months and years after the removal of those birth controls. It's not very common at all to get pregnant right after removing, although it's possible. Most women will find that if they're ready to conceive again, that we can work with them to help them nourish their body's hormone production and help them to have the healthiest environment restored after removing those birth controls.
Wonderful. Thank you for answering all my questions so well. How long will it typically take to see noticeable changes after starting BHRT?
And within a couple weeks to a year. So there's certain things that will happen very quickly. Within a couple weeks, people wake up feeling like they might not need their morning coffee. They might just want it because it tastes good now, but they have the energy right when they wake up, which is very quick to be noticed. Deep sleep gets to be something that's noticed within a couple weeks. And then some of the things that take a little bit longer are the things that we're wishing we could make happen faster, like the weight loss and the muscle building. But those things are affected and impacted by the hormones, and making you feel motivation to go to the gym is often half the battle. And that's one thing that most people will report, that the hormones give them their gusto back.
Oh, that's wonderful, because that's exactly what I need. We've had a gym membership for a while, and I've only gone a handful of times because I'm like, oh, my joints are hurting today, or I'm just not feeling that motivated. And so, I totally,
Yeah.
I
That's
think all of
something
it.
so common. You're not abnormal at all. Yeah.
Yeah, especially you're in the sunshiny state, California,
Yeah.
and we're in the rainy state, but we're just coming out of our summer season. But it's
Yeah.
it's a big deal. I've tried to gather all my girlfriends together to go work out, and it's just like the motivation part is really the largest thing, and all the comfort foods that we go for in the
Oh, yeah.
wintertime,
Oh, yeah.
so it affects.
Totally.
Yeah.
Yeah,
So
it's weird how that is like the switch that happens when people get their hormones optimized, is that they all of a sudden have less cravings and they have more motivation to do the healthy things. So you kind of get a win-win where you're like, oh, by default, my brain just wants me to be a little healthier. So I think I'm going to go with that.
how wonderful. I mean, you can think of all the things that you could save. I mean, if your grandparents are going through Alzheimer's, if you're, women, as they get a little older and their hormones change, they can get heart problems down the road. So
Right.
it's really preventative as well. Like she's saying, you can, even if you're not having these signs and symptoms, to even start that. I mean, I've heard people have, their muscle tone, without working out, starts to regenerate again. And so that's, how wonderful would that be to keep, you have to have muscle tone in order to not get osteoporosis. And so, and it affects also people that have blood sugar disorders. So muscle tone is extremely important. So my health nutritionist said, work on your legs, because that's where your biggest muscles are. So if you have to start somewhere, start lower, to start generating a lot more results faster. Right? That's what I heard anyways.
Yeah.
So let's see, what is the long-term treatment plan, and will I need to be on BHRT indefinitely?
So long term, we basically talk to patients about helping them to clean up their life with their toxins, and we work with them to do all the things they can within their power to let their body produce their hormones naturally. Okay, and alongside that, we provide them with the options to replace. At a certain point, the production is most likely going to go away naturally. We know about menopause. We know that after menopause that there are many changes that happen for most people. So at that point, we say, if you want your cup to be full with energy, you can continue the hormone replacement for life in a very safe way. So it's your choice, but how long do you want to feel great?
Oh, that makes perfect sense to me. And it's all natural. It comes from our food. And so our body considers it just like eating food, only you're putting it in a different spot, which is almost like your little muffin top is for women, your spare tire for men. So, and it's just a small insertion, takes a second. It lasts for 4 months. You don't want to let it lapse, because you'll see a decline. So you got to keep coming in if you're going to get I heard the pellet is more popular.
Yes.
Nobody wants to take pills and have to forget their creams, and they wonder, so you want it to be steady, smooth and steady. And with every heartbeat, I guess it releases. So naturally, your body will naturally release it with every heartbeat as well. And so it's absolutely bioidentical to what your body would naturally be producing anyways.
That's exactly right.
So it's a win-win. And, I can't help but think, as I do study longevity and life expectancy and the blue zones and things like that, I watch shows. And I noticed that the Asians in Europe, they eat the yams and the things that actually help their hormones. They make sure that they eat the fish that actually helps, balance out some of the issues with their thyroid and whatnot.
Yes. Exactly.
Diet does affect the way, and do you help with that? Do you help put them on some kind of a
Yes.
regimen of sorts?
Yes, we work with patients if they want to work with our naturopathic doctor. She goes to the root of the problem and she helps them with diet changes as well as learning what nutrition to eat to optimize, like you mentioned, the thyroid. And we find that there's more and more patients that are getting off their thyroid medication because we're helping them to optimize their thyroid function with natural and safe nutritional supplementation.
And you have a wonderful team of osteo doctors. I've looked at your team. So
Yeah.
it's a wide range of doctors and things that to work together to make a person whole and well
Yes.
again,
Yeah.
which is wonderful. Are
Thank
there
you.
any contraindications or reasons why I shouldn't consider BHRT?
Not that I can think of.
Okay. So all natural. Again, this is wonderful to have you on our show, Carol Bender. And please give her a call at joywellnesspartners.com. Her and her team are ready to take any questions that you have. And thank you for being on Edge and Regen Med Show. I'm Tori Stevens, and we'd love to have you on again.
Thank you so much, Tori. It's been an honor.
All right. God bless. Thank
God
you all.
bless. Uh-huh. Bye.